This video will show you test-taking strategies to employ while taking nursing exams. You may think that mastering nursing exams will be nearly impossible. If you are already thinking negatively, you are already setting yourself up for failure. Henry Ford once said, "Whether you think you can or think you can't, you are right." It's important to know that mastering these exams is mind over matter, and it is a very accomplishable task. We are ready to talk about our testing strategies. Before you take an exam, you need to be sure to prepare. Preparing does not mean cramming before the exam. When you properly prepare using a study schedule and effective study techniques, you are working toward decreasing your anxiety and building your confidence. Be sure to follow your regular routine the night before an exam. If you have prepared effectively, there will not be a need to stay up late cramming, and this can actually do more harm than good. Be sure to arrive on time, but do not discuss the exam with classmates or frantically study. Your classmates may have some inside scoop from a student who previously took the exam, but you do not want to listen to it. Negativity could creep in and really affect your positive game plan. Quickly looking through the material may seem effective, but chances are you are doing it at a rapid pace. This will increase your heart rate and cause you to breathe quickly, resulting in increased anxiety. So avoid the urge to glance over the material one more time. Be sure to bring everything you need to take the exam, and above all, remain positive. Before we dive into specific test-taking strategies, let's talk about general strategies you can use for all exams. When you start the exam, be sure to read all directions carefully to ensure you know how to respond to exam questions. You will also want to take note of how much time you have to complete the exam and how many questions you need to answer. This will give you an idea of how much time you can spend on each question. When you begin the exam, answer the questions you know first. This will build your confidence and also allow you more time at the end of the exam to work through the questions you do not know. During the exam, do not look around the room or worry about how long it is taking you to complete the exam versus other students. A smart test taker uses all of the time allotted to complete the exam. Each student is different, so never compare yourself to others in your course. You also need to keep in mind that you will come to questions you do not know. Do not panic if you draw a blank. Simply move on to the next question and note the number of the question that you skipped. If you focus on the fact that you do not know the answer, you will build your anxiety and change your positive focus to your negative feelings. If you are unable to skip the question, look away from the exam and practice relaxation techniques. Once you feel calm, reread the question. Finally, be sure to trust your instinct. You know the material and you need to trust yourself. Now that we have covered general test-taking strategies, let's take a look at more nursing-specific testing techniques. When reading a test question, you will want to ask yourself two questions. What is happening and what should I do? These two questions will help you focus on the meat and potatoes of the content. In order to answer these questions, you will need to identify keywords contained in the exam question itself. Again, these keywords will help you identify what is being asked and will help guide your response. Words like not, never, contraindicated, unacceptable, avoid, unrelated, violate, and least are negative words and are usually concerned with what is false. Words like first, initially, best, priority, safest, and most are concerned with priority. Questions with these keywords will require you to place a value on each response and rank the responses. If you have difficulty ranking the responses, eliminate the most wrong answer and try again. You will want to refer to the basic theories like Maslow's hierarchy of needs, the nursing process, ABCs, the idea that the patient is the center of the healthcare team, and others. If the question is asking you to identify the most important, all options may be appropriate. In this case, you will need to reread the question to identify any keywords you may have missed. You can also rephrase the question into your own words to really help determine what is being asked of you. The keywords can also help you identify who the central person is in the question. Is the question concerned with the patient, a family member, or someone else? Identifying who the question is really about will help you eliminate incorrect responses and help you hone in on the correct choice. The question is not the only place you will look for keywords. Specific determiners can also help you choose which response is best. Words like just, always, never, all, every, none, or only are typically false, so you will typically want to avoid choosing one of these responses. These are important words to look for when you are having difficulty choosing the correct response. Another great hint for nursing-specific tests is to look for the patient-centered option. The patient is the number one priority, and nurses must always concern themselves with the patient's well-being first. If the response is patient-centered, it is usually the correct choice. Once you have identified the key words, rephrase the question into your own words to really make sure you understand what is being asked of you. Be sure to avoid reading into the question. Although you may have wonderful experience or other background information, answer the question using only the information provided. Reading into the question can cause you to overthink and choose the wrong response. A really great way to help yourself avoid typical testing pitfalls is to try to answer the question without looking at the answers. Once you have an answer, find the response that best matches your answer. This practice will help you avoid reading into the responses and will help you choose the correct answer. Here are a hodgepodge of other test-taking strategies you can utilize while taking an exam. Identify opposites in the responses can help you eliminate choices. Either one will be correct, or you will have to eliminate both. Typically, when you have opposites listed as responses, one of these choices will be the correct answer. Look for equally plausible or unique options. Usually, if you have two equally plausible options, these choices are distractors and can be eliminated. If you have three equally plausible options and one unique response, the unique choice is likely to be the correct answer. Look for a global option. These options are typically more comprehensive in general in comparison to the other responses. The global option is usually the best choice if the other options are specific. Identify duplicate facts among the options. Usually, identical or similar statements appear in at least 2 out of the 4 options. If the fact is incorrect, you can eliminate the 2 choices that contain the fact. If it is true, you can choose between the 2 options that contain the fact. Identify options that deny patients' feelings, concerns, and needs. A nurse is the patient's advocate, and this means that nurses cannot always be optimistic. Choices that imply everything will be fine, change the subject, encourage the patient to be cheerful, or transfer nursing responsibility can usually be eliminated. All of these strategies can be implemented to help you successfully pass your exam. After taking your exam, be sure not to discuss it with your fellow classmates. What's done is done, and there is no point to get dragged into any negativity. Plus, you do not want to imply a test was easy or hard because you could have others who have not taken it yet. You want others to go into the exam with a clear mind and make the determination of hardness or easiness on their own. After the exam, you can always make an appointment to discuss your performance with your instructor. You can discuss incorrect questions to determine why they are incorrect, and you can discuss the rationales behind correct choices. It is important to engage in this dialogue for you to consistently work toward improving your performance and build your understanding of question rationales. You'll thank yourself for taking the extra time when it comes time to sit for the NCLEX. Finally, you will want to evaluate your studying and test-taking strategies. What worked? What didn't? What would you do differently next time? What should stay the same? You can learn more about testing and nursing by reading Test Success, Test-Taking Techniques for Beginning Nursing Students. Here you will find more in-depth explanations of each strategy, as well as sample questions for you to work through using the tips provided in this video. If you take only one thing away from this video, please let it be the lesson of positivity. You must believe in yourself and the rest will follow. You can do this, and the strategies you learned in this video will help you on your path to success. For help with this topic and more, check out our Answers database where you can search our frequently asked questions or chat with a Rasmussen librarian.